So today we're going to be talking about mobility aids.
You there, young lady. You're too young to be using a cane.
That is the most annoying phrase I have ever heard, ever. Let's talk about it. So, I use a cane. This is Sandy. She folds up. I decorated her. Why she's named Sandy, I just don't know. People ask me all the time why I named her Sandy. She felt like a Sandy to me, so her name is Sandy. I have this neat little clip on here so I can clip her to items to keep her standing. I got this extra piece so that she stays standing all on her own. I've used her in airports, at work, at malls, walking around downtown Portland, things like that. So she's really useful. I rarely use her, and that's the goal. I don't want to be using her daily or even weekly, ideally. Essentially, when I'm using her, I haven't been listening to my body, or I'm refusing to listen to my body and deciding to push it to keep walking, to keep doing things, to keep working, to keep getting me places. And so Sandy is helpful in that regard. So let's talk about the phrase, "You're too young to be using a cane." I hate that phrase. I hear it almost every time I use Sandy. Every time. Why? Why? My age has nothing to do with my reason for using Sandy, and there are many people who are my age and younger who need mobility aids, and their age also has nothing to do with the reason that they're using their mobility aids. And you don't know me from Adam or Eve, and you're making medical decisions on my behalf? What? How does that? No. So I hate that phrase. I hear it from regular clients at work who see me normally not using Sandy, and then random days using her, and they don't understand why. I'm more than capable of telling you exactly why. I tell people when they say, "Oh, what's wrong?" I tell them I have fibromyalgia. I use her on my bad days. Today's not that great. And so I needed her to help me get around. Essentially Sandy helps me. She helps me get from a sitting position, so I can use her to hoist myself up out of a sitting position. My hips commonly are painful. I use a cushion while at work, like a orthopedic cushion. I use it in cars or anytime I'm going to be sitting for a long time on a chair that isn't going to be comfortable. I use it. Weirdly, my orthopedic cushion doesn't have a name. If you have a good idea for a name for it, I wouldn't mind naming it. I name everything. So I use Sandy to help me get out of chairs, to walk. So pushing off of Sandy and propelling myself forward is a nice way of using less energy to move myself forward, or to move myself, to keep myself walking. So if I have to walk for long distances, I'll use Sandy. I often change which hand I use Sandy in, only because sometimes I will have shooting pain up my leg and into my hips, making it more difficult to walk on that leg specifically, whichever one it may be. So I might be using her on that side to help that leg from falling out from underneath me. Also, I swap sides because the more I use her, the more I keep pushing my body when I shouldn't. I lean more and more on her, and as you can see, she has like a rubber handle. It's not super soft or cushioned, and so it'll start to hurt my hands and my arm, whichever side I'm using her on. So then I'll swap to the other side to give that arm a break. But yeah, so she helps me get from sitting positions to standing positions. She helps propel me forward. And when I am very painful and it's a really bad day, I can be dizzy. So she helps me keep my balance, make sure I don't fall over, anything like that that comes with being dizzy. She does it. She's wonderful. But ideally, the goal is I don't need to use her because I'm listening to my body. I'm taking breaks when I need to be. But sometimes you just can't get past that. Sometimes you have to go get groceries when you have no groceries in your refrigerator and therefore nothing to eat. Or sometimes you need to go to work to make money to buy said groceries so that you can eat. Or sometimes you're traveling and you just, walking from the security to a gate at an airport is a long walk. I will have a future video because I have taken Sandy and flown by myself since having fibromyalgia, and that was a whole interesting ordeal, and I'll have a video on that later. But needless to say, she comes in handy when I have to push myself and keep going and I can't listen to my body. So, yes. Let's see. I know other people in the community who have not needed to use any mobility aids. I know people who have had to use like more than just a cane. I find that I only need the cane, and if I'm really, really bad, then I'm just gonna be staying in bed. But yeah, so I like Sandy because she folds up and because she helps me get from places when I need her to. And suddenly my illness is visible, like suddenly people see me using a cane and they wonder why such a young woman is using a cane. It makes my chronic illness suddenly visible to everyone and they wonder what's wrong with me. It's great. But without her, I'm just a woman walking slowly who looks young and fit and who seems to be struggling to walk for some odd, strange reason. But with her, I'm a young woman who looks fit, who's struggling to walk with a cane. But hey, I have a cane, so suddenly my chronic illness is visible to the world. So sometimes she's nice for that. Just to be able to be like, yeah, I have an illness and I'm walking slowly for a reason. That's all. So, yeah. Let's see, what else? Mobility aids. That's all I really can think of. I just Mochi is trying to get some food out of her bowl. You can hear her crashing her bowl. I swear we feed her. Let's see. So, yeah, that's probably my least favorite saying that I get, why, you're such a young person using a cane. I have had very nice people wonder why I'm using a cane, and I let them know that I have fibromyalgia and yada yada, and they're very sweet about it. And I have had others who are like, give me weird looks and don't say anything. I'd almost rather you just ask. Just ask. And I feel like, to me, Sandy is an empowering thing for me. I know individuals who have known me prior to me being ill enough to need to use a cane, and they see me using a cane and they see it as a sort of sadness that I have to use a cane now. But to me, I find her empowering because, one, she shows my chronic illness. She makes it visible for others to ask questions and wonder why. And two, she gets me going places when I'd obviously just need to stay in bed or stay at home. And she helps me get places. And then three, because I think, it's not common that someone my age would be using her. And I would like to change the dialogue around mobility aids for young people. It can be very condescending or demeaning, such as that phrase, you're too young to use a cane. And I hope that in the future, individuals see people using mobility aids and see them and use empathy with that, towards those individuals. Because, we're using them for a reason. It's not for the fun of it. I don't know anyone who would be using a mobility aid for the fun of it. Yeah. So, yeah, I would just say empathy. Empathy first. Woo. Yeah, that's all I have, I think. Thanks, everyone. This was a shorter video, but I really wanted to get this out there because I feel like I do truly hear that phrase every time I use Sandy, and I feel like I love Sandy. I think she's important to me because she helps me get places, and I love the fact that I'm able to use her, and she's able to help me get to places that I wouldn't, like keep walking, being able to do things reminiscent of the time before I was ill. So like going, walking downtown Portland around shops or things like that. She lets me do that. And I ideally don't use her more than I want to say twice a month, maybe 3 times a month. Truly, it's a good day when I leave her at home, and it's a bad day when I'm using her, but she's letting me do the things that I love to do, or allowing me to have the capability of choosing to do things I want to do that might require that I need her. So maybe going on a short hike, I would take her with me just in case later on in the hike I'm gonna need her, but I still get to enjoy going on that hike. I get to enjoy being outside, getting a little exercise, things like that. So I like the fact that I have her because of those reasons, and I really hope that the next time you see a young person using a cane or some sort of mobility aid, you treat them with empathy, and maybe you just, mind your own business. Unless they seem like a person you might want to ask a question to, then maybe, but maybe just mind your own business. Bye!